Hello everyone, my name is Dr. Carla Marais, and today we're going to talk about cardiovascular disease and the COVID pandemic. A lot of people with comorbidities find the need and feel the pressure to stay healthy during this time. From what we know is that people with cardiovascular disease and hypertension are more susceptible to contracting COVID, but also have 10% more chance of suffering from severe complications. I'm sure you've also heard about all the rumors and seen the articles about antihypertensives increasing your risk for COVID. According to the American Heart Association and from the publications in March 2020, we know that this is not the case. It's not true. There's no evidence to suggest that they increase your risk. If you do change medication, this is supposed to be done with the best evidence at hand. So please discuss this with your healthcare provider. So knowing that cardiovascular disease and COVID creates the perfect storm, what can you do to decrease your risk? Get control of your condition. When last did you do your blood pressure? And do you know your cholesterol level? Are you keeping up with your chronic follow-up with your healthcare provider? And are you ensuring that you do not run out of medication by collecting your scripts frequently? Also, have you done your annual investigations? For example, have you done an ECG this year, an eye test, seen a dietitian, and have you done your annual bloods? These are all part of your chronic bundle. Eat clean and wholesome foods. Eat the food as it was intended in nature. Eat the apple, don't drink the juice. Stay away from processed foods. Also limit your salt intake. Avoid things like seasoning with salt, eating soya sauce, or biltong, for instance. Avoid bad fats and eat good fats. Examples of bad fats are sunflower oil and margarine, and good fats like avocado oil and oily fish. Exercise frequently, at least 30 minutes a day, 4 days a week. You shouldn't be able to sing a song while you exercise, so get a proper sweat on. Avoid excessive alcohol use and smoking. Try to sleep properly, at least 8 hours a night. Also try and incorporate breathing exercises and meditation into your daily routine. This decreases your stress levels. Meditation and exercise itself helps to decrease your heart rate, which in turn helps to decrease your blood pressure. So it's a good idea. Another way to reduce your cardiovascular disease risk is to reduce your risk for atherosclerosis. Atherosclerosis happens when fatty substances adhere to the inside of your artery walls. This increases your risk for embolism, and it also decreases your elasticity of the vessel walls. Embolism is when a piece of this plaque breaks off and travels to where it's not supposed to be. For example, your brain or your heart. And then we get what we call strokes and heart attacks. To reduce this risk, we need to improve your inflammation risk. And this you do by eating healthy. So reduce your sugar intake, reduce refined foods. Adhere to local restrictions. These are in place to protect you and those around you. Practice social distancing. Wash your hands frequently and wear a cloth mask. If you suspect that you have COVID symptoms, please let your healthcare provider know as soon as possible. Remember to stay connected. Talk to those you love frequently. We all need support in a time like this. Be well, stay well, and feel well.